So very warm welcome. Good evening, those of you who are joining from India, and good morning, Dr. Vikramjit Mukherjee. Good morning, those of you who are joining from the US. Thank you very much. I hope you're well and you're taking good care of yourself. Well, just one quick housekeeping rules. I am going to be controlling the microphone for everyone, and everyone currently has been muted so that the quality of the audio is consistent. So our speaker and myself are the only ones who are unmuted. So if you need something to be communicated, please use the chat box and send that to us, and I'll try and pick that up. Well, at this stage, I would like to make a special welcome to Dr. Vikramjit Mukherjee. And thank you so much, Vikram, for taking the time out from your busy schedule on a Sunday morning in New York and trying to, I'm trying not to say this, but I guess I have to say, for those of you who don't know, Dr. Mukherjee is also my brother-in-law. And me being slightly older than him, I took my liberties and got him to do this conversation. As a quick introduction, professional introduction, Vikramjit Mukherjee is a critical care specialist and is a director at the Medical Intensive Care Unit at Bellevue Hospital in New York City. Bellevue, for those of you who don't know, is one of the oldest hospitals in the United States and serves as the tertiary referral center for the city's public health system. His academic interests lie in providing care for patients with special pathogens, mass critical care, and ICU operations. Dr. Mukherjee, thank you very much. It is a true honor that you're going to spend the next 60 minutes with us, taking the questions. A big salute to you and your fellow medical officers, doctors, for doing what you are doing. It's truly a great job at the front line. We have approximately 150 participants on the call at this moment, and I know a number of them are still trying to join in. We are streaming it live on FB as well, so many of them are watching things there. There are a number of doctors and people from the medical fraternity also on the call, so thank you everyone, each one of you, for doing what you're doing with the novel coronavirus. So Dr. Mukherjee, if you're ready, I'm going to jump straight into the questions. There are as I mentioned to you, the questions were collected in advance, and it has been the condition
Sorry guys, I'm losing audio a little bit here. Geez, I can't hear you too well. Okay, guys, so while Geej, this audio, Geej, we lost your audio, so couldn't quite hear the last question. While Geej reconnects, guys, I just want to extend my thank you for your time here. I hope you can hear me, but thank you for coming. And I'd like to share what our experiences here in New York City have been over the last 2 or 3 months. And hopefully Bombay, Calcutta, wherever you are, doesn't have to see the ugly face of this virus like we have seen, but it does bear for me to share the experiences we've had so that you can keep yourselves and your family members safe. And again, as Jeej gets his audio back, I'd just like to remind you that this is not a virus that should be trifled with. It's a new virus that's been known to humankind only for the last 6 months, and we are still learning how it behaves and how it affects patients. What we'll talk about today is essentially based on existing data or existing evidence that we know so far. So I think Jeej is back, and we'll open it up to questions. Thanks, Jeej.
Thank you. So sorry about that. I don't know why my Wi-Fi does this to me. Every time I test it, it's fine, but I'm back. So the first question, Vikram, that I wanted to ask you was, what are the conditions that might put somebody at a higher risk?
Absolutely. So unfortunately, being old is a risk factor. People who are above 65 years of age are at a higher risk factor for being critically ill from this virus. Having existing hypertension, diabetes, and being obese are also significant risk factors. And then lastly, if you have pre-existing diseases like COPD, any lung diseases that you might have, you might feel much sicker than an otherwise healthy person if this virus affects you.
We've been talking about this oximeter. Can measuring oxygen at home, would that help in assessing the onset of COVID?
It won't. So for a pulse oximeter is something that measures your oxygen levels in your blood. It won't really help you diagnose whether you have COVID infection or not. But if you have, it will help gauging the severity of the illness. So for example, if COVID spreads to your lungs and causes issues with oxygen transfer from the atmosphere to your blood, your oxygen levels in your bloodstream will fall, and that will be caught on the pulse oximeter. So while it's not great for diagnosing an infection, it will help you gauge how severe the infection is and whether you should go to a hospital to seek medical help.
And if the oxygen level is less than optimal and there is no breathing difficulty, what would you recommend?
So if your oxygen level is less than 92, 93%, that is a time when you should seek medical help. In general, I would like to urge that hospitals, especially in cities that are seeing a lot of patients, are places to be avoided. You should not be going to a hospital unless it's absolutely mandatory, because you can imagine hospitals often act as amplification zones where you have one sick patient in a busy waiting room or a busy emergency room, possibly infecting many, many other patients. So unless you have to go to a hospital, and by that I mean unless you have a dire medical emergency, please, I would suggest that you stay away from hospitals, especially if you're in a city which is seeing a huge number of patients like New York City did. But that said, the pulse oximeter, if your oxygen levels are less than 90 to 93%, that's a sign of trouble. That's a sign when you should seek medical help and go into the emergency room, because things can go from bad to worse very quickly under this disease.
So just so that you know, and for the attendees' benefit, what we have done, all the questions, sort of broke it down into different buckets. And the first few questions that I'm asking are more on the introductory, getting to know the disease, and some medical questions that have come up. And then if we can go to 3 big buckets, a great suggestion from a friend of ours to club it into pre-COVID, during COVID, and post-COVID. And then finally, before we sign off, come back and ask you some questions, especially, you mentioned about we should avoid going to the hospital. There were some questions around relaxation, so we'll come back to that. The other question, and I guess perhaps a little bit about how to stay safe. Hot water and steam has been something a lot of people are prescribing to continue to use. Does this really help kill the virus in your body?
So hot water and steam will help you feel a little bit better. This virus usually presents with nasal congestion, with a sore throat, and with a cough. So hot water and steam might provide some symptom relief, but it will not have any effect on the virus. It is not a virucidal agent that will kill the virus. it will help you feel a little bit better. Just like if you have the seasonal flu, hot water and steam will help you maybe calm the inflammation on your throat. It will help you feel better, but it is not an antiviral by any means.
And since we are warming up with some simple questions, the other one which I have here on my list is, are there any superfoods that you believe will help protect us with the virus?
Unfortunately not. That said, a healthy diet and exercise helps you become stronger and helps you combat the virus if it hits you. But eating GMO foods or superfoods during a viral infection, unfortunately, it does not have any antiviral properties per se.
So I come to a set of questions, and many of them have been asked by doctors, medical fraternity who are on the call. So we get a bit technical. Corona being a virus, why is the drug of choice an antibacterial and anti-malarial?
Oh, that's a very good question. Thank you. So a month or so ago, to prevent coronavirus from affecting people, there were some recommendations on using hydroxychloroquine, which is a drug used in lupus, and azithromycin, which is an antibacterial. Both of them were being used for their anti-inflammatory activities, not for their virus-killing activities. Unfortunately, over the last couple of weeks, there's been pretty strong data coming out of New York showing that neither of them are of much benefit and have a significant side effect profile. So most guidelines here are suggesting that we move away from using that either for prophylaxis or for management in a patient who's infected. So not much of a role of either of those medications for COVID-19.
So in fact, my next question on the list was related to HCQ as a prophylactic medicine. And somewhat, if I understand correctly, the data which is coming out, at least in New York, HCQ doesn't seem to be a preventive measure. Is that what I understand? Is that correct?
Yes, that is correct, Jeej. And while there are different government agencies which have different stances on the use of HCQ, the overbearing data is that it doesn't do much to prevent or treat COVID by any means.
And this is probably very simple for you. I don't understand the question. Please explain what ISVA prophylactic medicine is. Does that? I'm not sure whether the question has come out correctly.
ISVA is not an acronym I'm familiar with. Is it what is a prophylactic medicine?
Oh, I think that's right. I guess that's how. Please explain what is a prophylactic medicine. Yeah.
So a prophylactic medicine is something that you take to prevent an infection from affecting you. Therapeutic medicine or a treatment medicine is something that you take to stop things from getting worse once you have the infection or the disease. So prophylaxis is to prevent it from happening. Treatment is to treat it once that has already taken onset. Okay.
Moving on, and just give me a minute. I see some questions popping up here. Again, it's very medical. In your opinion, can the CBC report, and if you can explain what that means, of the patient tell you whether he is COVID positive? And linked to that, ratio of neutrophils to lymphocytes, can that be an indicator? You'll have to explain these medical terminologies to some of us.
Sure. So a CBC is a complete blood count. It's an acronym for a complete blood count. And it's a routine test that physicians often order to see how much your white blood cell count is, how much your hemoglobin is, and how much your platelets are. They have, inside the WBC count, there are multiple different ways you can have that compose your WBC, and there are different lines. In COVID-19, one of those specific lines that one of the specific types of white blood cell counts can go down. And what we technically call is leukopenia, or the leukocytes can go down in that setting. It is not diagnostic by any means, but if you see a white blood cell count which shows or exhibits leukopenia, that should, at least in these days, trigger an alarm for whether this patient has COVID-19 or not. It's one of the many things you can look for to raise the index of suspicion in a patient with COVID.
Okay, there was one specific question to to you, and I'm just trying to find it. Just give me half a second. Yeah, this is a very specific question. 68-year-old patient recovered from prostate cancer recently. General query around what precautions should be taken apart from distancing oneself, and how does somebody as old as that recovering from prostate cancer build immunity?
Great. So first of all, congratulations on beating cancer, and I hope things went fairly smoothly. Secondly, as we grow old, as we have other medical issues, we become more prone to getting not only COVID-19, but facing the ugly face of COVID-19. Things that you should be doing, not only at home, but if you do venture outside, are wearing a surgical mask anytime you're within 6 feet of anybody else. So if you are staying at home, but you have people visiting you, however close you are in terms of family or friends, if you're within 6 feet, you should be wearing a mask, not only to protect yourself, but also to protect the person around you. You should be washing your hands with a fair degree of regularity, either washing your hands with soap and water for 20 to 30 seconds, or using an alcohol-based hand rub, Purell, every few hours, especially before you eat or come in contact with young kids or so forth. And thirdly, you should avoid touching your mucosal surfaces. COVID-19 mostly spreads by respiratory pathway. So if someone sneezes or coughs in front of you and you inhale that cough, it would go into your lungs and possibly infect you. So you should minimize touching your nose, minimize touching your mucosal surfaces like your eyes, and washing your hands, wearing a mask as much as you can would be all things that you should do. Also, if you have a fever, a cough, or shortness of breath, you should be careful about at least calling your physician up and seeing what to do next.
Okay, thank you. There is again a specific question from a medical from medical fraternity. Obviously, seems to suggest there are some articles that thrombosis is a cause of death in COVID patients. Is there a blood test to check for thrombosis?
Great, thanks, Jeet. So thrombosis essentially means that you have a blood clot, either in your veins or in your arteries. And these can have significant ramifications if they go untreated or even with treatment. What we've learned over the last 3 months is COVID puts you at extremely high risk for developing not only venous thrombosis, which is fairly common, but also arterial thrombosis in the forms of heart attacks, in the forms of strokes in people with no other risk factors. We're still learning about this disease, but COVID-19 is indeed a very prothrombotic disease. Why it occurs is still under investigation. Things that you can do to diagnose thrombosis in the hospital would be a CAT scan of your chest, a CT scan of your head, and so forth. But there is a blood test called a D-dimer, which we often check at the bedside to see if someone has developed COVID or not, who has developed thrombosis or not. And the blood test is called D-dimer. It's one of the, when you have a clot, that level usually goes up.
We'll move slightly away from the technical aspects and ask you a question around what is the standardized treatment protocol in the US. And we appreciate that you're sitting in the US, the ground reality in India may be very different, and it may be different city to city in India. So all that you're saying and responding to today, we will take it with a pinch of salt. But just curious to hear your thoughts on what is standard treatment protocol in the US.
Okay. So let's start from home. So essentially, the first thing, especially in a city like New York, which has seen hundreds of thousands of cases, is that you should not go to a hospital unless you absolutely need help. If you have a fever, if you have cough at home, you should call up your physician, of course, but try to use telemedicine and a phone call as much as you can instead of going to a busy physician's office, waiting in a waiting room where there might be, even if you're not the person who's infected, there might be another person who's infected and pass that infection on to you. Go to a busy emergency room and similarly increase your risk. So the first thing is, please try not to go to a hospital unless you absolutely need to and you have an emergency. The second thing is try to maintain social distancing as much as you can. And we'll harp on this more, but this is a very communicable disease. It transmits from person to person very quickly. And you have no idea whether the person who's visiting you, whether the person who's within 6 feet of you has an infection. Sometimes they might not have any classic signs of infection and might still be communicating the disease. Classic things like fever, cough, shortness of breath happen later on in the disease phase, but might happen after they become infectious. So just because someone doesn't have a fever doesn't mean that they don't have an infection. And that becomes a huge public health challenge because you have no way of knowing whether your colleague, your family member has an infection or not. So if you're talking to even a close friend, even a grocery shop person, please wear a mask, not only to protect your colleague, but also to protect yourself, as long as you're within 6 feet of that person. Now, suppose things get worse and you're in the hospital. Unfortunately, there's just one medicine so far that has been shown to have any benefit in this disease. Everything else is supportive care. What the hospital will probably do is to check your oxygen levels. If you need oxygen, they will put you on some nasal oxygen to keep your oxygen levels above 92 to 93%. Everything else is supportive. God forbid if things get worse, the hospital will probably transfer you to an ICU where supportive care will continue to be offered. The one medicine which even the US is in short supply is an antiviral medicine called remdesivir, and that's fairly new medicine in this field. It's not part of a lot of treatment algorithms just because the data behind that has barely come up less than 2 weeks ago. Everything else in this disease is supportive care, with supporting the breathing, supporting your blood pressure, supporting the kidneys if things get worse.
Okay, in fact, that was one of the questions from the attendees, whether remdesivir is being used to treat patients currently. So thank you for that. Vikram, there are a number of dentists on the call, and you know why so. And a number of them from Bangalore, from Bombay, Delhi, they have questions around how vulnerable dentists are to COVID in the Indian scenario, and especially with the aerosol procedure, and what sort of protocols should be followed, and whether just wearing PPE is good enough or not. So generally, broadly, if you could guide us with some thoughts.
Okay, yeah, that's a great question again, and thank you for offering that. I'll just like to highlight what an aerosol generating procedure is. As we mentioned, COVID is primarily a disease of the lungs and the respiratory tract. So the virus mostly lives in the lungs, in the trachea, in the airway, and in the oropharyngeal tract up here. Anything that is able to transfer or convert the viral particles into an aerosol, which is basically a dense particle, becomes a huge risk for healthcare workers and people around them. Even simple things like nebulization, things like putting a breathing tube down someone's throat are huge aerosol generating procedures. So we approach that with a lot of caution. In the dental field, there are, from my understanding, a lot of procedures that generate aerosols as well. My knowledge of those is relatively superficial, but when dentists operate on the upper airway and the mouth, they often inject high-speed saline, and that can often aerosol infectious particles. And that puts not only the dentist, but also the dental assistant and people around them at a high risk for getting this disease. So at least if your city is being affected and the numbers in your city are relatively high, I would urge you to treat your outpatient dental practice in terms of only people with emergency should come to you. Everything else that can wait should wait till this surge is over. And even if someone comes to you for an emergency, you should basically assume that the patient has COVID, even if the patient doesn't show any symptoms, and take maximal precautions. And by maximal precautions, I mean that as soon as the patient walks into the waiting room, he or she should be given a mask so that they don't infect someone else in the waiting room or your staff. They should be given a lot of hand hygiene so they can wash or sanitize their hands. And they should at least maintain 6 feet if possible. I know even here the busy waiting rooms cannot allow for that, but maybe you can time your appointments in a way that minimizes the amount of time somebody waits in a waiting room. When they're in your clinic on the operating table, you as a dentist should be very careful, because you'll be very close to their mouth, which is a portal of exit for this virus. And you should be wearing PPE, protective equipment, in the form of a face shield so that your eyes are protected, in a form of an N95 mask, which protects you from any aerosol generation, gowns and gloves. And I would keep emphasizing that if your city is seeing a surge of COVID-19, which essentially most places in the world are, please treat every patient as if the patient is potentially infected till proven otherwise. Again, the fever doesn't always help. The absence of symptoms doesn't always help. And you being in such close proximity to the patient's mouth puts you at immense risk. So I would suggest that telehealth plays a big role in being able to do virtual consults, and in the clinic, you pay heed only to patients who have a true dental emergency.
Thank you very much, Vikram. I'm going to move to my next section, and first of the three, pre-COVID situation, some generic questions, general questions. Does vitamin C and D help prevent symptoms or help you recover fast? Is COVID only associated with low-grade fever? Is that usually the first symptom? So generally, if you can give us some thoughts on the whole pre-COVID bucket, general thoughts.
Oh, absolutely. Thanks. So the pre-COVID prevention is key. Any ways that you can prevent you or your family members from getting infected prevents a lot of badness down the road. So, for example, like I mentioned, try to minimize people coming into your house, especially if you're living in a place that's seeing a surge. Minimize going to restaurants, going to bars, going to places even of where you know you will be in a close-knit community. Like I said, this is a very communicable disease. So prevent social interactions as much as you can if the place you're staying in is seeing cases. Secondly, unfortunately, there is not much data for vitamin C or vitamin D. We have used it in patients who are on the verge of death as something that doesn't hurt and only can help, but there is really no data in using it for prophylaxis or for treatment. And then the fever, so the natural progression of the disease is, I'll just walk you through this for the sake of, suppose person A is infected and comes in close proximity to person B. There is a chance that person B also gets infected. The incubation period, which is the number of days between exposure to disease onset, is usually between 2 days and 14 days. So while the person B might get infected today, he or she will not show symptoms for usually a week after that. Now that week is important because person B is possibly transmitting that disease, even though he or she doesn't know that he or she has the disease and is not showing any symptoms. That is a very dangerous period because there is no way of knowing whether that patient has a disease or not, and that becomes a public health nightmare. Once the disease onsets, it usually starts with a fever, and fevers can be low grade to high grade. We've seen fevers here of 107, 108 in people who are very sick. After the fever comes, or with the fever comes the cough, and with the cough comes often on shortness of breath. Hopefully it stops there, and over the next 2 to 3 weeks, the patient recovers, but around 5 to 10% will continue to fall more sick. And those 5 to 10% are patients who have risk factors like hypertension, older age, diabetes, obesity. Once they come into the hospital, if they need to come into the hospital, they might have a low oxygen level. Most of them will get better with just some oxygen supplementation, but around 25% of them coming into the hospital will end up in the ICU with very severe disease. The ICU course, unfortunately, is quite dramatic. Patients end up on the breathing machine, on the ventilator for days to weeks. Renal failure often comes after that, and a lot of our patients need dialysis, even though have perfectly normal kidneys after that. Here in the US, we are seeing an ICU mortality of close to 60%. So 10 out of 10 patients coming into the ICU, despite aggressive critical care support, 6 of them will die. The ones who survive often need long-term breathing support and long-term kidney failure support. Thankfully, only a small fraction of everybody who's infected end up in the ICU. But even a small fraction of a lakh is a fair number of patients. So that's the disease progression. Hopefully none of us get it. Hopefully if a few of us do get it, we stay at home and we get the milder form of the disease. And I just pray that none of us end up in an ICU with the more severe critical form.
Quite scary, I must say, but is there a particular reason why there were so many deaths or the mortality rate was so high in New York City? Is there something we need to fear about seeing what is happening in New York in a city like Mumbai or Delhi?
Yes. So one of the reasons why New York City got hit very hard is because it's like Bombay, like Calcutta, like Delhi. It's a very densely packed city where social isolation and self-isolation is not always very possible. People here often live in families of 8 or 10 people, and if there's one person infected, asking for that person to isolate himself or herself is often not possible. And that becomes a very vicious cycle where that person often infects his elderly parents, his young kids who are more prone to disease, and that sequence continues to follow. New York City relies heavily on a public health system, the metro, the subway, and that becomes a vulnerability because social isolation when everybody's using the metro, it becomes very difficult. And lastly, I think one big advantage that India has had is that India has socially isolated, has put down immense social restrictions early, which is a big factor in being able to, control this disease. Of course, it comes with a huge economic toll, and I can see the logic behind trying to open it up at some point. But as things open up, the chances of this resurfacing are very high. Of course, the answer to that is not closing down the entire country, be it the US, be it India, forever. The economic toll is unmeasurable. But as businesses open up, as restaurants open up and people come close to each other again, this being a communicable disease will most likely go up in numbers again.
And I do have some questions towards the end of the discussion around that, because we have seen some announcements overnight about relaxation. So I'll come to it, but going along with the list that I have, is it true that the earlier the treatment is started, the better the results?
Yes, the only treatment that there is out there is that antiviral drug. If you can give it within the first 48 hours, it will improve the results, but it's not that efficacy. All it does so far is to cut the number of days you're hospitalized for. It has no, so far at least based on existing data, there is no effect on whether you will live or die, whether you will end up on a breathing machine or not. All it will do is, if you are hospitalized, it will cut the number of days you're hospitalized. For you to get the medicine, you would have to be in the hospital. You wouldn't be able to get it from home.
And how many days one must wait to get a swab test done?
So if you have a fever and symptoms, low oxygen levels, a cough, you might want to talk to your doctor about getting a swab test done. As soon as you have a fever, you might want to get tested, especially if you have older parents or younger kids at home, so that you can protect them rather than protect yourself if you're young.
Okay, and how reliable is the swab test?
The swab test, unfortunately, is not very reliable. It has a lot of noise to it. The sensitivity, so by sensitivity, I mean that if you have a test, if you have the disease, how good is the swab in diagnosing the disease? It's at best around 60 to 65%. It depends on how where you are. If you're very early in the disease, you might not have enough viral particles to be diagnosed on the swab test. It depends on how good your sample collection is. So if the nurse or the physician doesn't go back far enough in the nose, you might get a falsely reassuring sample. And it depends on the quality of the test as well. So there are a lot of false negatives in the test. So if you have fever and cough and everything else that classically comes with this disease, please don't be falsely reassured by a negative test. It might be fooling you.
And if I flip the question, since I'm a lawyer, can there be a false positive test?
Very unlikely. It's pretty specific. It catches only this virus, so very unlikely to have a false positive test on this.
Interesting. And you may have covered this, but how fast does the infection progress, and can that be different in the city that you are living in, New York versus Bombay versus say Bhopal? Just as a follow-up to that question, because what if we have delayed testing, and is there excessive damage because of the delay?
That's a great question. So the strain that came to New York came from Europe, which is a bit different than what made China, Wuhan very sick. One of the possible reasons why Europe, Italy, and the US, New York City at least, fell sick is we think that there might be the New York City / Europe strain might be a bit more dangerous than what was in Wuhan, what was in Seattle earlier this year. The absence of testing can be a very dangerous thing to have, especially early on in the disease, because unless you know that someone is positive or negative, you have no way of isolating or source controlling that index patient. We, especially in New York, in March, had a lot of issues with getting adequate testing, and that, to a degree, impaired the city's response in how well to control this disease. The testing should be done as aggressively as possible. At the slightest hint of fever, all healthcare workers should be tested if they have any fever and so forth. But testing is key to managing this public health disaster.
Sure, and just a small follow-up to that one. How many days after the first onset of fever is the patient still infectious?
So can be up to 2 weeks. We say that you should be in quarantine. So if you have been exposed to a known patient, you should quarantine yourself for 14 days. If within those 14 days you develop a fever or a cough or diarrhea even, you should think about getting tested. If you develop fever, you're usually infectious up to 3 days after the resolution of the fever. Now that has to be spontaneous resolution. You cannot take a fever medicine and say that the fever has gone. Your fever has to resolve for 3 days without taking any medicines. And after that, you can come out of quarantine and continue your normal work.
Okay, thank you. I move to the second bucket, the bucket where you have tested positive. What should the family be doing, especially the close family members? Do they also get themselves tested if somebody in the family has tested positive?
So it would start at least with quarantine, at least for 2 weeks, since most family members live in close proximity to each other. If one of them, say it's a family of 4 and one of them gets infected, the other 3 should at least self-quarantine themselves for the next 14 days. If within those 14 days, someone has a fever, then that person should get tested. Now keep in mind that if testing means that you go to a hospital, to a busy emergency room, it might not be worth the risk. Simply because if you're not positive, just going to the emergency room has a huge risk factor in making you positive. So if you have a fever in those 14 days, one thing to do, and it's a very reasonable thing, is just consider yourself to have COVID, monitor your oxygen levels with a pulse oximeter, monitor your symptoms, and unless things get worse, stay away from the healthcare setting. We know very well from this disease, from previous similar viruses, that busy emergency rooms, cruise ships in this case, flights in prior cases are essentially petri dishes where one person can infect many other people if they're not careful.
So I'm going to ask you a question about flight, but before that, there are a number of asymptomatic cases. What care can we take for the fear of unknown?
So if you're coming within 6 feet of a person, wear a mask. This mask will help you not transmit the disease to the person coming in contact with you. It's within 6 feet is where you got into trouble. So if you're coming within 6 feet of anybody, if you're going out shopping, if you're going to a mall, what have you, please always wear a mask. You'll see in New York City, almost everybody in the streets is wearing one of these masks. The other thing is, if simple things like shaking hands becomes a healthcare, because who knows whether the person you're shaking your hand with has rubbed their nose or touched their eyes. And shaking hands, something as conventional as that, becomes a risk for disease transmission. If you would, carry one of those small hand sanitizer bottles with all the time with you. So anytime you've touched something, this virus exists on all kinds of surfaces. And unless those are cleaned, can last for a fair number of days. So you should be, not wear gloves, but at least hand sanitize yourself before you come in touch with your kids, before you come to your elderly parents. And then if, the last thing would be, try to isolate as much as you can. I know that's easier said than done. And we as a human species are a social animal, so it's not easy to isolate yourself for long periods of time. But do that, because most of us on this call are relatively young, but we're not doing it for ourselves. We're doing it so that we don't bring this disease back home to our young kids and to our older parents.
No, thank you. That's very, very, very informative. So do I understand you correctly that one should stay away from flights unless it's really, really required, even with masks and face shield, and who knows, maybe somebody will wear a PPE and get onto a flight?
And I would suggest avoiding non-essential travel as much as you can. We know, so for COVID, there's a lot of research going on from Boeing and Airbus about how safe flights are. We know from other viruses which are similar to COVID that flights impose a huge risk factor. You can imagine you're in a car, in a plane with air that's being circulated. There are filters and so forth, but they're not perfect. And you're in a closed space, barely 2 feet away from your neighbor for hours on end. And that's not a way to socially isolate yourself. So unless you have essential travel, I would suggest, and that's along with the CDC guidelines, to avoid going on a flight.
Sure. No, thankful. Very, 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 very clear. Just as a follow-up to this section where a family member has tested positive, is there something one can do in terms of taking precautionary medicines? Because there are some queries around. People have got started on HCQ, and we know your thoughts on HCQ and AZ. And generally, what is the protocol you're adopting in New York? It may be different in India. What is the protocol you're adopting and what you see in the US?
Yes, so a couple of months ago, we were using hydroxychloroquine and azithromycin to prophylact against getting this disease. A lot of healthcare workers, because they are in close contact with patients who are infected, were taking it. There's at least a couple of trials coming out now that show that it has no benefit in either prophylaxis or treatment. And both these drugs can cause some cardiac arrhythmias, some disturbances in the electrical conduction of your heart. So in the absence of good data and a significant side effect profile, my suggestion would be to avoid taking these two medicines. I know that the ICMR is still working on finalizing the guidance in India, but at least staying away from individual country guidance, the data suggests that there's not much use of either of those two medicines.
Understood. And how long does it usually take for a patient to completely recover?
That's a great question. Yeah, so it depends on how sick the patient got. If the patient has been in the ICU on the breathing machine for weeks, has had renal failure, has seen the ugly face of this virus, it can take months to recover. We have patients here who've been admitted since mid-March, who are still on the breathing machine, whose kidneys still haven't woken up, who are still bedbound, and have what we call chronic critical care. And they've been so weak because of all the trauma that they've gone through, they will take months to walk again, to eat through their mouth again, to talk again. Thankfully, that's just a small proportion of all comers. The mortality risk, so of 100 patients who get affected with this disease, only around 3% will die, and around 5 to 10% will become as sick as needed to be in the ICU. The rest, 90-95%, will recover over 2 to 3 weeks and continue life as was before COVID. But the unfortunate thing is there's no way of predicting who's going to be getting the milder version and who's going to get the more severe critical version. Of course, if you have risk factors like old age, hypertension, and so forth, you are more at risk for getting the severe critical illness, but by far we are seeing here people who have no past medical history, who have been completely healthy, coming in with horrible, horrible disease and dying under our eyes. So being young and healthy does not protect you against this disease.
Quite scary, I must say. And is there any other way of transmitting the disease apart from, coughing, sneezing, touching?
It's mostly that virus particles have been found in other bodily fluids. It has been found in stool specimens, in semen, in blood if you're sick enough. But the primary mode of transmission is through the respiratory tract. While it has been found in all these other bodily fluids, there is no data to show that coming in contact with those bodily fluids actually transmits or not.
Okay, I'm going to ask one last question in this section because it's an interesting one. You mentioned about mortality rate in New York being very high. You mentioned about lockdown and early lockdown in India, perhaps making it easier for us. Has the weather got anything to do with it? Does the heat kill the virus? I mean, these may be very ignorant questions by lay people, but some of us are probably hoping that the monsoon will kill the virus and the heat will kill the virus. So your thoughts around that?
No, this is not a naive question at all. I think there is a lot of interest in that. In fact, a lot of hope that as summer comes, even in the US, this pandemic comes to a close. Unfortunately, places like Singapore had been hit. Some places that are not as cold as the US have had resurgences in this virus. I think time will be the answer to that. So as summer comes, we will hope to see. But so far, I wouldn't bank on warm summer weather killing the virus. From a scientific perspective, it doesn't quite make sense because a temperature of 40 degrees centigrade is not a viral killer. And in fact, we are more worried here in New York that as the summer gets and people go out to the beaches and to the parks and mingle more, disease transmission actually increases. So we are a little bit more careful about that here. But again, the reason I am a bit cynical about the whole warm weather hypothesis is that places like Singapore have gotten hit. Places like South Korea and parts of China, which are warm, have also gotten hit. So I hope there is some backing to that, but I wouldn't count on it.
Because of what you just mentioned, and since it is a little bit of crystal ball gazing, I'm going to ask you this question. I had told myself I won't ask, but how effective is homeopathy and all the other different treatments and camphora and I don't know, God knows how many other medicines which people are trying to take from an immunity perspective. I mean, you don't have to answer it, but just if your thoughts would be really nice on this one.
No, geez, I mean that's a good question. While I'm a allopathic doctor, I have a fair amount of respect for Ayurveda and homeopathy. If I would love for them to be studied, and if research shows that they are beneficial, I think that would be very useful. But outside the umbrella of a research trial which shows that it works, I would hint a bit of caution on using it as a tool to treat patients. But I would love that if there is a study looking at camphor, or even for that fact, vitamins, showing that it helps in this setting, I would be all for it. But outside of research setting, there's not much of a role for either of these two modes.
No, fair enough. I think very well said. I'm going to move to the third and the last bucket. This is recovery phase, post-COVID phase, and a lot of patients, people that we know, they're coming back after recovery. They're coming back home. How long is the person still infectious, and what sort of precautions should be taken at home for those returning back home? And in an instance where there are elderly people in the home, the patient is coming back to. Are there some protocols and thoughts that you would leave behind with us today?
Yes. So you're usually supposed to be infectious 3 days after you have resolved your fever. And by resolution of fever, it has to be without any medicines. You can't take a paracetamol and say that your fever has gone away. It has to go away on its own. But 72 hours after that fever has resolved, you should be able to discontinue taking all these special precautions. What happens long term is still unknown. As you know, this virus is new to mankind. We barely know about how it behaves for the last 5 or 6 months. So what its consequences are a year out, 5 years out, 10 years out. I can tell you that this virus is here to stay, but how it behaves a week, 2 weeks, 10 years out of its illness, we don't know yet.
Appreciate. And in terms of precaution, did you sort of suggest some precautions that should be taken?
And after 3 days of fever resolution, you can go back to normal normal operations, normal life.
And have you heard of instances of a COVID recovered patient getting the virus a second time, or is it like one time and then you become immune to it?
I don't think we become immune to it. We are checking antibodies to see if we have developed some immunity to it. But here we've had a couple of nurses who've had a second bout of COVID already. So just having infection once doesn't necessarily mean that you will not have an infection the second time. And you should continue taking the precautions as if you've never had it in the past.
Okay. Do you want to just tell us, 10 seconds, what this antibody is, just for laymen to understand?
Yes, of course. So in general, if you have an infection, the body mounts an immune response to it to fight off the infection. One of the ways it mounts an immune reaction is to develop antibodies, which basically help your body to combat the virus. Now, this antibody develops 5 to 7 days after you have the initial infection. So it might not be positive very early on. But once you have the antibodies and you can test for those antibodies in your blood, it gives you a sign that you've had this infection and you have recovered from it. Now, it doesn't tell you that you have lifelong protection against this virus. We don't know of that yet. It doesn't tell you whether you will have this infection again or not. But it does tell you that you've had this infection and you've recovered from it. There is some studies going on whether if I've had an infection and I've recovered from it and my friend now has an infection, whether giving my blood to that person might be of help. It's been shown to be useful in other viruses of similar nature. Whether it's useful in this particular pathogen is being tested.
Okay, and one more question on this. Are there any follow-up tests to be done on the patient to check full recovery?
No, it's mostly symptom-based. So if you're able to recover back to your pre-COVID quality of life in being able to walk as many stairs as you could, no cough, kidneys have woken up, all those things are good markers. There is no blood test to see whether, to gauge the recovery.
No, thank you very much, Vikram. Those were the 3 buckets. And then I have some very general questions around, the dilemma that we are in today with lockdown being eased, relaxations coming in, people want to get on with their lives. No cure or vaccine in sight. How should we get on with our lives? General thoughts. And of course, this may differ from being in a different city, of course, being in a different country, but generally, what would your thoughts be?
And so I would like to emphasize is that these are strange times. These are times that happen once in a century. The last time there was a pandemic of this scale was in 1918, which killed millions of people worldwide. And no one, not the hospitals, not the community, no one is prepared for a disease of this caliber. But that said, now as understanding of this disease progresses, there are ways to protect ourselves. And I think protecting yourself, protecting your health, your family is the first thing that you have to do in trying to avoid badness. The second thing is there will definitely be, for the next months to maybe 2 years to come, a different way we approach life. At least I can talk about New York. it's as you probably know, the city has been essentially shut down for almost 2 months, and it's going to be opened up in a very phased manner, and there are significant chances that the city or the parts or a different city goes under shutdown again. Essentially, what the thinking is that as long as your healthcare system is able to bear the capacity of patients, you should be able to open up the city to a degree. But as soon as your healthcare system is overwhelmed and you have no ICU beds, no hospital beds, you need to go back into shutdown, into lockdown. And this can happen 2-3 times till a vaccine is developed. Talking about the vaccine, it won't come out before a year, probably at best by January or February of next year. And even then, that's when the vaccine will come. Deployment of the vaccine to cover hundreds of thousands, millions of people will be a significant effort. And unless we have immunity, unless what we have is called herd immunity, which is basically our community as a whole has immunity towards this virus, this kind of death and despair will continue. And all we can do is wait, digest the economic harm that comes with it. But these are strange times, and I don't think anyone is prepared for it for the next months to come. I'm sorry to paint such a sobering picture, but being in New York, we've seen the ugliness, the death and despair that this virus has caused, and I would pray that this does not affect you wherever you are.
So just so that you know, Vikram, we've had announcements for relaxation and a release of lockdown in a phased manner. Nobody knows what that phased manner means because it's still a trial and error. But from 8th of June, when the first sort of ease out is going to happen. And there are a lot of people asking a lot of questions around that. When should I go to office? How do I get on with our lives? And the sense we get from you is that, well, it is very difficult to tell. But you mentioned about Spanish flu and herd immunity. What's your gut? What's your thought? How long are we going to live with this?
So COVID-19 is here to stay. It's not going anywhere. It's going to be one of the viruses that stays with humanity for the next hundreds of years. It will not affect us once a vaccine is developed, once herd immunity is developed. It will not kill us as often as it is right now. Right now, it is new to mankind. We have no immunity. We have never seen it before, which is why we are so susceptible to the ugly picture of it. But as a vaccine comes into play, as herd immunity comes into play, we would be able to account for this virus, treat it like a common flu, and get over it by mounting a more robust immune response. But it is going to be part of the viruses that affects us every year for what I see it is eternity.
And in terms of a second wave or a resurgence coming, do you see that resurface and do you see that happen? Is that a likely scenario?
I would say it's almost inevitable. We don't have anywhere close to the herd immunity that will offer us protection. Herd immunity comes when you have around 80% of your community infected and has developed antibodies. Even in New York, we're close to only around 20%. So at some point, the social isolation, the social distancing has to be uplifted. Otherwise, the economic toll, and people will die of heart attacks and strokes, and kids will miss their vaccinations. So it's not a solution to just close down a city for months to years. So as the social distancing gets uplifted and people mingle with themselves more, there will be more transmission. Hospitals will see a second wave, a third wave also. And what we can do in the meantime is to prepare ourselves best for the ugliness to come.
Tough, very tough. My last question from amongst those which we had prepared and received from the attendees, is there any scientific or anecdotal evidence that the intensity of COVID-19 virus is reducing over a period of time?
No, the numbers are coming down because of how, at least in the US, I can speak to that in places that have been hit hard, like Seattle, like New York, the numbers are coming down, but that's a consequence of the social distancing measures that have been implemented. in places of the US and in other places of the world where social distancing has not been possible, numbers continue to rise. And as a consequence to that, hospitalizations and ICU admissions will also continue to rise. But the virus hasn't mutated much to show that it can have a milder picture. So I think we should continue to treat it with a fair degree of gravity.
Thank you very much, Vikram. I think that's been immensely helpful. I know we are getting to the hour, and I promised you that we will not take more of your time.
If I may just pass on a last comment. Guys, I don't want to paint a very sobering picture of this. I'm probably emphasizing on how bad this can get, but I just want to keep in mind that when you're at home and healthy, please protect yourselves as much as you can. Don't take this lightly. This is not a time to go to a restaurant, to go to a bar, to have a party at home. Please be patient. Wait for this phase to go over. If you're coming in people that you don't know very well, please wear this mask and wash your hands as much as you can. And if you're young and healthy, do it for your parents and do it for your kids, just so you don't bring the virus home. You will be okay with it, but people who are more frail and fragile, if they get the virus, might not do too well. So just on that, I would like to urge on the message of caution that prevention is 100 times better than cure.
No, thank you very much, Vikram. I think that's a message which should be the key takeaway for everyone, because I think people sitting at home for all these days, weeks, months are seeming to get a bit edgy and wanting to step out and do things which they haven't. And somehow many people seem to believe that they have won over the virus and not realizing what is out there. So absolutely, I totally agree with you. And I see your parents also listening in. So you should wave out to Aurobindo uncle and Asha auntie. And of course, there are lots of other relatives that I see. But Vikram, it's been an absolute pleasure to have you on the conversation. This is the third of the series, and I intend to continue further as well. I know there have been a lot of questions, but I'm so sorry there was limited amount of time, so I couldn't have asked all of them. Vikram obviously needs to get along and do other things, but next week, Sunday, most likely I'm going to have a friend or maybe friends who have actually gone through COVID, been COVID positive, and are at different stages. So those of you who would like to listen in, I will be circulating another group, and we will form another group and join that for next Sunday. Dr. Vikramjit Mukherjee, I think I have no words to thank you. Whatever I say will be less. I think it has been an immense learning. The candor in which you have shared what you know, it completely defies the age that you are. And you said most of the people here are young. I would say you are the young one. Most of the others who have joined are much older to you. You've been absolutely fabulous in terms of what you're doing, what you've shared, and more strength to you and the likes of you. The world needs many people to get over COVID, and thank you so much from all of us, deep from our heart. Thank you so much. I'm going to unmute everyone, and I think everybody should. I think I've unmuted everyone. No, you can unmute yourself now, and please a round of applause. Thank you so much. Again, it's been absolutely fabulous. So for those of you who missed out on, I'm going to mute everyone now. Those of you who missed out on something, there is a recording of this which is going to be on the Facebook page. So you can always go back and listen in there. And with that, I'm going to sign off. Dr. Vikramjit Mukherjee, thank you very much, and everyone else, please stay safe, stay well, till we meet again, maybe next Sunday.
Thank you, doctor.
Thank you, doctor. Thank you, June.
Thank you, doctor.
Thank you.
Thank you, doctor.
Thank you, Dr. Vikram.
Thank you. Thank you.
Thank you, Ravindra. Thank you, doctor.
Thank you, doctor.
Thank you.
Thank you, doctor.
Thank you, doctor.
Huh?
Thank you, doctor.